it's very swollen, right? So, and it kind of has that look of residual swelling. So I think as you guys go along, you'll start to feel that. If you guys want to later, you can kind of feel around his ankle. That's what we would consider as boggy. Okay, so it's boggy. It means that it's staying kind of in that joint capsule area in there. So there's not a lot of fluid. I can work on this, but it's really staying localized to where that it's encapsulated into that ankle. Okay, so for him, we would do big kind of milking maneuvers. I would actually probably elevate him. I'd get him way up high, elevate him, and then do a lot of bigger strokes for the to get some of that fluid out of there before I would go in and go more local to really assess what does that fascial line really feel like. Okay, we check the joint integrity too, right? I want to see like what does his joint feel like, how does that feel. And even though he's got hardware in there, I still want to know what's happening at the distal fibular head and that distal tibia. Okay, so I'm going to come in and do all of that. If you guys look at his scar, so Cole, can you kind of bend? What's it look like right here?
Train track.
Yeah, train track. So he had a ORIF, right? Open
Reduction.
Thank you. Tuesday, I can't talk. So, but I would first go at it and just assess right across the scar. What does it feel like? What's he gonna tell me it feels like? What do you tell me it feels like?
Feels fine.
So fine stands for freaked out, insecure, neurotic, and emotional. So what does it feel like, Cole?
I don't feel a whole lot on the skin.
Okay, so it doesn't feel a whole lot, okay? I would then want to check the tract on the outside of where the scar is, okay? And I'm feeling that there's definitely adhesions on both of those sides, okay? And so treatment-wise, I'm going to think of priorities for him. Number one is we have to get that swelling moved out, okay? Number two is I want to maintain the integrity of his joint mechanics because that's what requires when he's walking, right? Every step he takes, something's not happening. So if I check his joint integrity,